Hi everyone, this is Dr. Janvi. In this video, I'll explain about thyroid disorders. Thyroid disorders and their types. Thyroid disorder occurs when thyroid is not making the right amount of hormones. There are two types, hypothyroidism and hyperthyroidism. Hypothyroidism is usually defined as deficient production of thyroid hormone. Hyperthyroidism is usually defined as excess production of thyroid hormone. In my last video, I spoke about hypothyroidism. In this video, I'll tell you all about hyperthyroidism. Hyperthyroidism is a condition where your thyroid gland makes a lot of thyroid hormones than what your body actually needs. Let's learn about the causes of hyperthyroidism. Most common one is Graves' disease. It is a hereditary one. Here the immune system creates a protein called thyroid stimulating immunoglobulin. It's an autoantibody which signals the thyroid to increase its production of hormones abnormally. As we all know, thyroid hormone is made up of iodine. Excess of iodine can increase the production of thyroid hormones. Thyroiditis can damage the thyroid gland and release the stored hormone into the body. Thyroid nodules or extra growths of thyroid gland can increase the amount of thyroid hormone production. Some tumors of ovaries and testes can also increase the amount of thyroxine. And thyroxine intake due to hypothyroidism in large amounts can also lead to hyperthyroidism. Let's talk about the symptoms of hyperthyroidism. Most of the symptoms of hyperthyroidism are due to increased metabolic activity due to increased production of thyroxine hormone. Firstly, unintentional weight loss despite not doing dieting. They cannot tolerate heat, feels anxious all the time, menstrual abnormalities in women like decreased menstruation, palpitations like knowing one's own heartbeat, increased sweating, going to bathroom many times, unable to fall asleep, moist skin. Looking at a person, we can say he or she is suffering from hyperthyroidism. Swelling in front of neck, bulging eyes and staring look, shaking hands. To know whether the person is suffering from hyperthyroidism or not, we usually do blood test and measure the levels of TSH, T3 and T4. If TSH is lower than normal and T3, T4 are raised, then it is hyperthyroidism. So let me tell you all about the treatment. Hyperthyroidism is because of thyroid overactivity. So to decrease its activity, we give anti-thyroid drugs. And if you have heart symptoms on top of hyperthyroidism, we give beta blockers and iodides. Radioactive iodine is given to destroy the hyperfunctioning part of thyroid gland. And if you want to go for thyroidectomy, that is removal of thyroid gland surgery, you have to do it in euthyroid state. That means the T3 and T4 hormones are reaching the normal values. If a non-pregnant woman who is taking methimazole in hyperthyroid condition, she should be switching it to propyl thiouracil before conception. Thyroid surgery is done in toxic symptoms like bulging eyes, swelling neck, and if the swelling is compressing underlying structures and causing pressure symptoms like difficulty swallowing and voice change. The treatment of choice for pregnant women is only propyl thiouracil in hyperthyroidism. Some things are compulsory to avoid if you are suffering from hyperthyroidism, like seaweed. Then if you are going for CT scan for any reason, then do not go for iodinated contrast dyes. Then some cough syrups containing iodine or bromohexane and health supplements that contain iodine. Thank you all for watching.